This is a beaver heart.
The freezer in Muriel Betsina's home is always stocked with traditional food. Not the case during her 9 years at residential school, where the food was foreign, bland, and scarce.
365 days a year, you're hungry. We eat stick fish, half rotten. We can't eat that. They keep the plate for you the next morning.
Researchers from the University of Toronto say hunger was widespread in residential schools across the country. They point to a lack of government funding paired with poor facilities and untrained kitchen staff. Testimony from former students at the Truth and Reconciliation Commission's hearings paint a grim picture.
Rarely being fed meat, for instance, or when they were fed meat, it was often spoiled meat, rotten meat. Survivors describe rarely eating fresh fruits and vegetables.
Based on what students said they ate, researchers estimate many children ate between 1,000 to 1,400 calories a day. The normal range for healthy development starts at 1,400. Famine studies in China and Russia found similar caloric intake led to stunted growth, greater risk of obesity, developing type 2 diabetes, heart disease, and poor pregnancy outcomes.
There was specific government policies that produced many of the health outcomes that we're seeing now in Indigenous communities.
I don't remember vegetables. I don't remember fruits.
Paul Andrew doesn't remember being hungry in residential school, but pressure to eat what was on his plate has stayed with him. He struggled to keep a healthy weight.
Even to this day, I find that if I go to a restaurant and I get a big meal, there's a sense that you have to eat everything, the sense of guilt.
The researchers are calling on physicians to ask former residential school students about their experiences during checkups. They're also well aware many Indigenous children face high levels of food insecurity today. That in turn could have lifelong consequences. Kate Kyle, CBC News, Yellowknife.